So we are live on YouTube now, and I'm Neetu Vadva. I welcome everyone today, including Dr. Vikas. I'll take 2 minutes to introduce Scleroderma India to each one of you, and especially to new patients who have joined very recently. A warm welcome to Dr. Vikas and Dr. Avinash. So Scleroderma India is a patient support group which got started in 2006. It is committed to spread awareness among patients and their caregivers. It aims to empower patients to become self-advocates. We want to support patients and families through guidance, counseling, formal and informal, and other ways. We want to tell the patients you are not alone in this journey. We are there to walk alongside with you. We are there to help you out. Let me introduce quickly to our team. I'm Neetu Vadva. I'm the co-founder trustee of this trust. I've got IT experience in my pre-diagnosed life, which is helping me in shaping the trust. Rashmi Basim, who is the project director for Scleroderma India Trust, she got extensive corporate experience. She works with 2 NGOs, including Scleroderma India Trust. She has been instrumental in starting and supporting projects ever since she joined last year. Pinky Thakral is a trustee. She has got global experience in entrepreneurship, and she brings the perspective of caregiver to the board. Ajit Tolani is special advisor. He lives in US, but he commits his time and his passion towards the trust. Being a patient since quite young age and a double lung transplant warrior, he is quite deeply involved with Scleroderma India to spread its wings. For all the new people and people who are watching us on YouTube and if on Facebook, these are our social media handles. You can reach out to us on any of the social media handles over here. And there are a few housekeeping rules. This session is being recorded and streamed live on Scleroderma India's YouTube and Facebook page. Please keep your microphone on mute when you are not speaking. On Zoom, to ask any question, you can raise your hand and moderator will call upon you. On YouTube and Facebook, to ask any question, you can type it in comments. And any question which remains unanswered after the session, we will get the answers from the doctors in the mail for you. So you need not worry that your question is not answered. This was a very short introduction about Scleroderma India. Now I will call upon Gautami. Now I'll call upon Sudha to take it forward.
Thank you, Neetu. Hello, good evening, everyone. I am Sudha, one of the Scleroderma warrior and volunteer at Scleroderma India. I warmly welcome all of you for today's session on behalf of Scleroderma India. And also, it's our pleasure to have Dr. Vikas Aggarwal and Dr. Avinash Jain for today's session to answer our queries that help us to combat our disease. So Dr. Avinash Jain has got up with some urgent meeting. He will join us a bit later. So we have Vikas Aggarwal right now for our today's session. I welcome you, sir, for today's session. Dr. Vikas Aggarwal did his MBBS and MD from King George's Medical College, Lucknow, India, and DM in Clinical Immunology from Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow, India. After a brief tenure as an assistant professor at Government Medical College and Hospital, Chandigarh, he joined back at his parent institute, Sanjay Gandhi Medical College, Lucknow, where he is currently serving as additional professor in immunology. And Saeed is also chief editor at Indian Journal of Rheumatology. Dr. Aggarwal sir is an excellent teacher, clinician, and also a research worker. He has more than 300 international publications to his credit, including NEJM and Oxford Rheumatology. In addition, he has been awarded with Dr. J.C. Patel and Dr. B.C. Mehta Awards by the Journal of Association Physicians India for the year 2000 and 2003. And also, he got awards for Best Paper at Indian Rheumatology Association Conference for the year 2004 and 2008. His areas of interest are scleroderma and also other fibrotic conditions, mechanisms of drug resistance in rheumatic diseases, and also tropical rheumatology. It's our great pleasure to have you here, Doctor. Thank you.
Thank you for your very warm introduction.
Yeah. So I'll hand it over to Rashmi to take it forward.
Good evening, everyone. Good evening, Doctor. I'm Rashmi, and I will be asking questions on the behalf of the group, which the group has already sent to us. So, without wasting much time, the first question that comes from the group: how do supplements help in weight gain or weight loss? Is doctor's advice necessary, or can we just buy OTC and start consuming them?
Like, as a medical person, first of all, I must tell you that there are no specific supplements which will help you as far as your weight gain or weight loss is concerned. And I don't recall actually writing any such supplements in last 35 years of my career after completing my MD. So as far as my perspective is concerned, I don't recommend any kind of food supplementations. And but even if somebody is recommending, then I must tell the patients who are getting these kind of advices from their respective doctors that they should follow the doctor advice rather than going for the OTC brands. Because many times we do see there is a whole list of such brands which are available on the net, and a lot of advertisements are every day coming to your social media platforms, whatever you are using. So one should not fall into the trap of nutritional supplements. Regarding diet, I will just suggest to you whatever diet suits you, whatever is sort of palatable and what makes you comfortable and what every other member in the family are eating, that should be good enough. If you are trying to lose weight, then it is good rather than believing in the diet to go for some kind of an exercise program, so that your calorie intake versus your burning of calorie per day by physical activities should actually take care of weight gain, and the negative balance can help you in reducing weight. For weight gain, I must suggest, though you may take it as a part of my humor also, that you are lucky that you can eat anything. So you don't need to worry, because every time we are advising people not to eat or to be very careful about their diet in losing weight. But I prefer that you should go for physical activities rather than. But if you are taking unnecessary calories, then obviously the diet needs to be tailored such that you avoid those kind of things. But for weight gain, I will not recommend anything to you except a good, healthy, normal diet which you are comfortable with. So I personally don't recommend any nutritional supplements.
This goes say, does this even apply to protein powders? Because we see a lot of doctors or even nutritionists saying that you should take some kind of protein powder. So even this applies to that as well, or is it
Yeah.
okay to take protein powders?
So very simple answer to that. Just find the source of that food nutritional supplement, be it a protein or be it anything. You will realize that they are all coming from grains, cereals, dals, and other respective dairy products. So why don't you take natural products? Why do you want to rely on those? Because they are caloried, they are giving you a label with how much gram contain how much of protein and how much of the calories will be there. Don't get lured into that. At a much cheaper rate and with a little chance of having any kind of adverse events to any food supplement, you will be far better off. I'll give you a point here because uh, uh, there's a disease which is eosinophilia myalgia syndrome, and it was realized that this happens because of some kind of a contamination in a nutritional supplement. So which actually mimics like scleroderma, the hardening of the skin and the fascia planes happen. So I don't recommend any kind of nutritional supplement. You should go for your normal diet. And you all know, we all know, and we can search on Google what kind of food items contain how much of protein, carbohydrate, and fats. So we can tailor our diet accordingly. Or you insist on your to your doctor that please advise us from the normal, or your nutritionist that please we don't recommend any nutritional supplement.
Thank you for that valuable insight, doctor, because this is something that we come across on a daily basis.
It unnecessarily increases the cost without much benefit.
Absolutely. Absolutely. Second question coming up, doctor. Now people are eligible to get booster vaccine. Should we take it or should we wait?
Yeah. Not only for scleroderma, for every damn disease, I will say you should go for vaccinations. Those who have not completed their vaccine, they should. And yes, they all should go for a booster vaccinations also. Because right now we don't have anything to fight with COVID. The only thing which is saving us is the vaccine. So we must take it. As of today, this is the treatment of choice. You can say like that.
Okay. So I hope this clears the doubt about vaccinations that is, we've been hearing.
Yeah. And remember, I am an immunologist, clinical immunologist. So my word is to be taken very seriously as far as vaccination is concerned.
Oh, yes, doctor. I completely agree with that. Okay. Next question, doctor. We have it. This is from Mona. MMF does not suits me. It gives me loose motion. How do I continue it if nothing remains in my stomach?
Yeah, so this is a very common problem with mycophenolate, and we do see diarrhea as a very common problem, and people actually withdrawing this drug because of this problem. So what I will suggest is, if there are no other alternatives to treatment protocol, whatever your physician or rheumatologist has advised, you can lower the dose of mycophenolate at which you are not having diarrhea, or otherwise go to the alternatives, which can only be suggested by your treating physician. There is no other way you can take or continue to take mycophenolate. So advice remains this: either lower the dose, which is best tolerable to you without side effect, or ask your physician to change the drug.
I hope, Mona, that answers your question. Next question is again from Mona. She says that she has low-grade fever from many years. This is accompanied by body ache. Hence, don't feel like doing anything. What should I do?
Yeah, this debility or sense of debility and some weakness, generalized fatigue or easy fatigability, this remains a common problem across all the rheumatic diseases. And this in particular is very common in scleroderma patients. So there are many things to it. First of all, you have to see like uh, what is your nutritional status? Are you taking adequate calories? That is one thing. Other thing is, are you taking drugs as prescribed by your doctor? And if he or she feels like this is because of the disease, because it's very difficult to quantify this symptom, but we can believe it that this could be because of disease itself. But there are other reasons also, like because scleroderma also affects your gastrointestinal tract, and many times a lot of essential vitamins and minerals are not absorbed properly, so they can give rise to these kind of symptoms. And especially when you have a chronic illness like scleroderma, which is not going to go away for years or for your lifetime, then there is an element of depression which creeps into mind. And many times patients when are depressed, they do feel like these symptoms. So one need to check whether your hemoglobin is okay, which tells about where your blood's oxygen carrying capacity, because that can also give rise to these kind of symptoms. Or your lungs are okay. There is no interstitial lung disease, or your interstitial lung disease is under control, and your oxygen carrying capacity of the blood is okay. Then uh, we can just try to tackle all these problems as part of generalized weakness and easy fatigability that you are saying. Also, ask your doctor. I'm very sure when you report these symptoms to your doctor, they always check for any muscle weakness, because many times muscle weakness remains very subtle. And we have seen many times, like when we start examining the patient in detail, this is because nowadays in COVID era, most of us are actually not examining patients with that much of clinical sort of rigor as we were doing in pre-COVID era. So that time, sometimes we miss on the muscle part. So by increasing the drugs, which can actually control the muscle problem, I think some of these symptoms can be taken care of. So try to maintain a good hemoglobin, good nutrition, and if there are no other, and if you are depressed, then try to talk to your rheumatologist, or take help of your some support group like this one, Scleroderma India. I think you can share your thoughts, and many of patients or the colleagues may come up and they can suggest how they have overcome this problem. Because I'm very sure in chronic illnesses, most of us will feel like this one. And be active, be a healthy lifestyle with a physical activity, sort of, so that you have some kind of a boosting. Because when we do some kind of exercise, is what happens is brain generates a lot of serotonin, dopamine, and 5-HT. So this causes a sort of boosting of your mind, which makes you happy, or also it boosts your immune system also. So things can actually improve with a healthy lifestyle by doing some exercises and taking care of rest of the things that I have told.
Okay, doctor.
Is it okay? Like when I'm replying like that, I'm throwing everything to you only.
No,
but
no,
but as a
it
medical
is
person, we
absolutely
don't have
fair.
many options to treat you with.
Absolutely. We understand, doctor. Okay, doctor, next question again is from Mona. Do hand splits help in keeping fingers straight? When to start wearing it?
Yeah, this is a very important and a very relevant question, because most of the patients who had chronic scleroderma conditions, after a few years, they tend to develop some degree of flexion contracture of the fingers or the wrist or other joints, especially the elbow joints. So yes, I do agree. If you notice that you are having a recurrent Raynaud's phenomena, which is severe, that is the bluish discoloration and pain in the fingers, and you are feeling like you are unable to extend your fingers completely, right from that symptom itself, one should be very careful in maintaining the hand hygiene. And when I say hand hygiene, I mean to say that please do exercise your fingers. Though I know when the fingers are ischemic, they cannot exercise. But I will tell you, if you keep yourself in a warm environment or keep your hands warm, the chances that your Raynaud's will be much suppressed will be very high. And once your Raynaud's is gone, or Raynaud's is very little, then you can exercise your fingers. And during sleep, you can use splints of the hands and the wrist, where you can keep your fingers straight and your wrist joint straight. So I think you have to start right from beginning. Many times it happens that, especially in our part of the country, where we are in the northern part of India, Uttar Pradesh, it takes many years to diagnose this condition. Even by visiting many doctors, the diagnosis is missed, because skin tightness may come after few months or few years of Raynaud's phenomenon. So, but since you are experiencing this, you should be more careful about your own hand functioning. So try to use splints if you feel like your fingers are not getting straightened up for 30 minutes or more after waking up. Then start using sprints in the night and do exercise your hands regularly by using soft balls so that you keep pressing them and releasing them whenever you have time during the day. So this will keep your sort of hand functions in a better state and will preserve the hand anatomy in most of the cases.
Thank you, doctor. Thank you for that answer. So, doctor, I'll take up the next question. So, a lot of us face significant hair loss. So, is it because of our scleroderma condition only, or is there some other reason for that?
Yeah. Since there is a background illness, we always tend to sort of blame scleroderma. Yeah, and scleroderma does cause hair loss. In fact, all the rheumatic diseases causes some or the other kind of hair loss. There are reports where people have shown around 40 to 50% of the patient may sort of complain of hair loss in patients with systemic sclerosis. And the quality of hair is also not very optimal as far as patients are concerned, because they may say that hairs are very thick or very thin, the color of hair has changed. So all kind of hair problems are there, and they can be blamed for because of the disease itself. In addition, there could be nutritional basis for hair loss also, because you can't do much about the hair loss in scleroderma except reporting it to your treating doctor, and in the best possible judgment of the doctor, he may advise you something. But if there are nutritional deficiencies, especially of vitamins and minerals, they can also aggravate, especially the biotin is something which is deficient and which causes or aggravates hair loss. So you can take some kind of as according to the advice of your treating physician, if he feels like there is a need for supplement of vitamins, especially biotin or other sort of drugs, then you can take it for your hair loss.
Right, doctor. I would just like to highlight one point over here. As you beautifully mentioned in most of the questions you answered, that we should always report back all our symptoms to our doctor. What happens is most of the time, patients don't report every symptom. They think these are small things, these are something else, and we will take care of them ourselves. So that is a very good takeaway point, doctor.
Yeah, the reason why I say you report to the doctor is that don't know. Many times there are small studies which gives us a clue that this particular drug, which was already available, has been reported to be beneficial in some or the other symptom, which can be taken now. So every day we are increasing our learning about the systemic sclerosis or scleroderma that we know it as. So it's always good to talk to the doctors, and sometimes doctors may recollect, okay, these kind of symptoms, they can be sort of improved with some drug which is which has been sort of reported in a recent papers.
Sure, doctor. Sure. Doctor, next question is regarding prostacyclins, because a lot of patients from north of India have actually talked about it. So, like we know, prostacyclin infusions are said to help in blood circulation, especially in winters. So, why they are not prescribed proactively to all susceptible patients who develop ulcer every year? Because prostacyclins have been prescribed to only those patients who develop severe ulcers going on gangrene. Why it has not been a general trend to give to most of the patients?
Yeah, very relevant question, but simple answer. See, every drug has a specific indicator, and so unless there is an indication, we cannot use it. That is one thing. So as far as the studies are concerned, the studies clearly mention that only in cases where you have either gangrene or pre-gangrene or difficult to treat ulcer, you use prostacyclin infusions. The other reason is that these drugs have a very short half-life. It's not that if you give it today, then the effect will last for 3 months or 4 months, which is around the period where winter lasts in this part of the world. So obviously you are not going to gain much if you give it prophylactically like that. Other thing is that these drugs are very costly and they can be only administered in the hospital as a continuous infusion. So occupying beds which are always scarce, so it's very difficult. And exposing yourself to the possible benefit which you anticipate without having any indication is not going to be sort of useful for the patient itself. And there may be a chance that if you use it recurrently, then the drug resistance may occur. And so when you use it when you need it for your ulcer or your pre-gangrene or gangrene like situation, then the drug may not be that effective.
Right, doctor. That makes a lot of sense now to us. Right, doctor. Next question also is from a lot of patients, that a lot of patients are not able to eat spicy food. Like including me, I have not eaten spicy food since past few months. My mouth hurts, but there are no ulcers. So what could be the reason and remedy for this?
Yeah, there could be many reasons for this. One is that what we can call it as sometimes glossitis, because there are many different types of glossitis which can happen, and glossitis is a very common symptom in scleroderma. And that can be because of some kind of iron deficiency, mineral deficiency, or vitamin deficiencies. So that can be taken care of by just taking care of the deficiencies. Other thing is that most of these patients, when they have had this illness for a few years, they tend to develop dry mouth, what we call as a secondary Sjogren syndrome. This accompanies most of the rheumatic diseases, including rheumatoid arthritis or your systemic lupus erythematosus. So when you have these kind of problems, because your salivary glands are not secreting a good amount of saliva, so your lubrication is not optimal, which is very much required for the optimal health of the mucosal layer of your mouth or tongue. Thereby, that layer, superficial cells got debrided, and whenever you eat anything which has got even the smallest spice, it will hurt you. Other thing is that many times the lower esophagus, we know that there is a esophagus in the throat, is starting from the throat and going to the stomach. The lower end of the esophagus, which actually enters where the food enters into the stomach, it is just having a dilatation. And almost more than 90% of the patients with systemic sclerosis will have a dilatation of the lower end of esophagus, which allows acid to reflux into the esophagus. And even a single drop of acid in the lower part of esophagus will bring in a burning sensation even up to the throat. Not mouth, but throat. So this is a very common symptom. So one needs to be, I'll tell you about this in more detail. I think there are plenty more questions coming for that. So these could be possible reasons for your sort of not able to eat spicy food. And in fact, we recommend all the patients, please don't eat food which actually make you uncomfortable. Also, whenever you are eating food, you should have at least a gap of 2 hours or more before you lie down. Food should be eaten 2 hours, at least 2 hours before. Raise the head end of the bed so that you put some blocks or some bricks below the head end of your bed, so that head end is raised at least for 4 to 5 inches. I recommend 6 inches. And don't use pillow or use a very thin pillow, so that your abdominal pressures are not increased. Because whenever you bend forward or you increase your abdominal pressure, there will be reflux. And because acid will find a way of the least resistance and it will go up into the esophagus and will cause problems and these kind of symptoms. So,
right, doctor.
Just not a very sort of a clear-cut remedy for your symptom. But if you just keep on trying, and there is no harm in eating actually non-spicy food also. I'll tell you that also. So I'll just tell you that I was in France for 5 months, and I just went for some lab training. there in city of Montpellier. And after 7-8 days, the whole lab actually treated me for lunch. So there were 13 people. We went to a cafeteria which was outside the lab across the road. And I asked because I am a pure vegetarian, so every time I had to ask them in French, please talk to your chef that he just uh, prepare food which is pure vegetarian, not just take away some meat or other things from the food items and bring it to me. So he did that, and then it was just some kind of a stuffed tomato and some rice, so very bland rice. So I just tried to put in some salt in it. I find okay, salt was less, so I put in some salt, and after that I tasted it, and I find that the now salt is okay as per my Indian taste. The whole 13 people were looking like this to me with wide eyes. I said, "What happened?" They said, "You have eaten all the salt of all of us for 1 year, one full year, in one food item." So, but this is our problem because we Indians have a habit of eating a lot of spicy foods. Whereas if you go outside, you will find bland foods all over the world. So it's not a problem to eat bland foods. It's just how you develop yourself. And by the time I came back to India after 5 months, and when I ate my food at home for the very first time, I felt like a burning sensation going through my esophagus. I said to my wife that the food is very spicy. She said, "No, it's like always, it is like that only." So it's just the habit of how you take on food, and I think non-spicy foods are preferred.
Right, doctor. That was a very interesting anecdote which you have shared over here. So I'll move on to the next question, doctor, from here. So next question is from Swati. She says, "I'm losing muscle mass day by day. What could be the reason?" Her doctor has shifted her from azathioprine to MMF, and but she feels good, when she was on MMF. So which one is good actually? That's what she wants to know.
Yeah. So see, loss of muscle mass happens. In fact, what you say as a muscle mass may not be correct because I think what you are visualizing is loss of fat, subcutaneous fat, because your skin has become tight and is adherent to the underlying soft tissues. So we tend to lose fat, and we may think like we are losing our muscle mass. That is one thing. But yes, there are reports where people have reported there is loss of muscle mass in patients with scleroderma. And the reasons are manifold. Could be disease activity, or if there is a concomitant overlap with the myositis, then the muscle loss is much more severe. Other thing if we are having sort of less nutrition, despite eating adequately, our gut may not absorb appropriately what is required, so we may lose muscle mass there. Or we are in a habit of not doing physical activities, that also leads to loss of muscle mass very quickly. So one need to be sort of reminding about all these things. So if you are feeling like that, be more physically active and have a definite program or definite lifestyle where your physical activities are adequate, so that whatever you are supposed to or required to do, whether you are a housewife or you are a working woman or a man, you can do that kind of activity which is required from you. Regarding the second part of the question, the physician has moved you away from MMF to Azoran. See, if you look at the pharmacokinetic and dynamics of these two drugs, one is a azathioprine, other one is and both are purine analogs that we called as medically. Both work similarly. Both are very specific for their action on lymphocytes, especially T lymphocytes. Only thing is that there were reports way back in 90s where people have reported that mycophenolic acid, that is mycophenolate, has got some better efficacy in patients with renal transplant. So from there, this concept of mycophenolate being better than azathioprine comes. earlier also, because some patients who have got a gene mutation in the TPMT gene actually tend to develop serious side effects of azathioprine. So this was not routinely being done word over at that time in 90s. So, and we were just doing a trial and error because I'm using this molecule since 90s. So I know that. And many of our patients will develop in 10-15 days cytopenias or derangement in their liver functions. So we were always scared whenever we used to start azathioprine. But if you look at closely the data in last 20-25 years, the efficacy of azathioprine versus mycophenolic acid are almost similar, even for renal transplant, for which this molecule was originally studied and evaluated, and thereafter it was evaluated in number of other conditions. So there is not much of a difference. But yes, it can happen that one may feel better with one drug as compared to the other. What we may pursue or feel as a medical person that, like if I may say that cyclophosphamide is better than azathioprine for treatment of interstitial lung disease and systemic sclerosis. This is because I'm saying there are reports where people have used cyclophosphamide and has shown, say suppose 60% patients had improved, and where there are studies which show with azathioprine only 40% improved. But in a given patient, it may happen that cyclophosphamide may not work, whereas azathioprine may work better. So if this patient feels, or Swati, if I remember correctly, feels like she was doing well with mycophenolic acid, she should go back to the doctor and ask him or her to change the drug back to mycophenolic acid.
Right, doctor. Thank you for that. Swati, I think you got your question answered.
Yes, ma'am. Thank you so much, sir. Thank you, ma'am.
Right. Prachi, you wants to ask anything related to this?
Hello.
Prachi, you want to ask anything related to this?
Yes, madam. Yes, question. One more question.
Yes, please.
Good morning, all of you. Good evening, all of you. Sorry. ये मैडम ये कल से अभी मैं देखा हूँ ये 3 दिन से इसने दवाई चेंज करी थी, अभी टरालाफिल ले रहे हैं 20 mg। तो ये मतलब हेडेक बता रही डेली मुझे, तो कहीं ये कॉज तो नहीं है कि टरालाफिल से इनको हेडेक हो रहा हो?
Yeah. So in fact, I must tell you that the tadalafil was introduced in Scleroderma by me only, though, and it is only our initial 3 studies which forms the basis of American College of Rheumatology and European League Against Rheumatology Association's current guidelines as far as in 2017, which recommends this drug to be used for all the scleroderma patients, especially those who are experiencing Raynaud's phenomena or are having digital ulcers or pregangrenous conditions. And this is a definite side effect of tadalafil to have a headache, flushes on face, warmth on face, paraspinal back pains or thigh pains can happen. So what I will suggest to you is that with a dose of 20 milligram, if you are having, you go back to your doctor and ask if he can reduce it to 10 milligram or 5 milligram, because it means that you are sensitive to this molecule. But unless we have a sort of a definite contraindication for usage of tadalafil, I recommend usage of tadalafil for each and every patient of mine of scleroderma for indefinite period, because this drug has immense benefit as far as scleroderma is concerned. So definitely this is happening because of tadalafil.
Okay, thank you, sir. Thank you.
Right, doctor. So I'll move to this another question from our sheet. So Swati wants to ask again, what is the reason for bladder leakage and fecal incontinence? Is it because of the medicines or disease? Or what can help in changing, either food habit or any medicine which can help her?
Yeah. As far as fecal incontinence is concerned, this is quite common in scleroderma. People have done elegant studies, though subjects were not many in each of these studies. most of these studies comprises of 10 or 15 patients, because you need to have a sort of a manometric evaluation of anorectal functions. And what people have demonstrated is that in systemic sclerosis, your sensations are very much sort of more active, hyperactive. You can feel the feces much more early as compared to the normal subjects. Though you have a potential, or your external and sphincter tone remains high, remains normal, but still, so that urge to pass feces is much more in patients with systemic sclerosis. For this, I think the best way is to go about is to have diets which actually allow you to sort of not have any diarrhea, do not have any small intestinal bowel obstruction symptoms or overgrowth of the bacteria, which causes most of this. So it may help. But as far as urinary incontinence is concerned, I don't think this can be related to systemic sclerosis. In most of the females, this happens because of pelvic floor muscle weakness. So you can go back to your obstetrician or gynecologist who can teach you some pelvic floor exercises, how to hold urine. Unless somebody is having a urinary tract infection, then the urinary incontinence can happen, but otherwise it should not happen. As far as fecal incontinence is concerned, yes, this could be part and parcel of systemic sclerosis. A dietary advice and sometimes usage of cyclical usage of antibiotics can help. But then again, this has to be prescribed by your treating doctor, and you need to follow that.
Doctor, I would like to ask a very related question over here when we are talking about diet for fecal incontinence. Another friend of ours, she is on food map diet, but still she's having the same problem. So what kind of diet can we think about over here?
Yeah, it's very difficult to have a very specific kind of an answer to that question, because you just keep on trial and error and find the best diet which suits one particular patient. Because every one of us has got innumerable billions and trillions of bacteria in our gut, and they produce all kind of metabolites. So we need to keep on changing and trying and finding which kind diet actually gives us a good metabolites, so that stool is well formed, is not loose, and this loose stool should not reach our anorectal junction, where it sort of gives an urge to pass feces, and only then probably it can be controlled. Yes, but on an average, if you ask me broadly, I will suggest do not go for sugars which are not easily absorbed by the gut, and because they cause a lot of this diarrhea-like sensations and fecal incontinence. So you can find a whole list on Google what are all sort of sugars which are not absorbed. They may be oligosaccharides or disaccharides or monosaccharides, which can be avoided in certain food items, especially fermented ones. The fermented food contains these oligosaccharides in a large quantity, so they can cause diarrhea. But you need to keep on trying.
Right, doctor. Thank you. Sure, doctor. I'll just move to the next question. So, sir, is ILD always progressing? Kya? Is it true that everybody will need oxygen after a few years?
If you ask me the first part, is ILD always progressing? As a medical person, I will say yes. But if you ask me about the next part, does everybody require oxygen? No. That is for sure. See, there are two varieties of, if we can classify patients into two different categories. One is a diffuse systemic sclerosis, and one is a limited systemic sclerosis. So patients with limited systemic sclerosis who tend to have more of Raynaud's phenomena and may have pulmonary arterial hypertension are at less risk of developing interstitial lung disease, And even if they develop interstitial lung disease, their progression of the disease is much slow and less severe. So that is one thing. Whereas on the other hand, patients with diffuse systemic sclerosis, around 60 to 70% will have significant lung fibrosis, which or interstitial lung disease, that you may also call it, which will require some or the other form of treatment. But we cannot say for sure, like all patients will have a progression of disease at a similar rate. No, there will be patients who will be stable for many, many years, and there will be patients who will be progressing very fast. So one need to just see the course of the illness and be in very regular touch with the either rheumatologist or a pulmonologist for this symptom, because this is a very life-threatening condition at times. And if it progresses, then we are left with not many options. And even today, lung transplantation, which is the last option for treatment of this kind of disease or this complication, are not available in India. There are hardly 1 or 2 centers which are doing it in India right now.
Yes, doctor, I understand that. That was very insightful, doctor. Doctor, do anxiety and psychosis medicines interact with immunosuppressants?
One need to see actually what drug somebody is prescribing, because there is a whole list of anxiolytics and antipsychotic medications which are available. But in general, if you ask me, I don't recall any interaction happening between these two classes of drugs. But then one has to be very clear. We can always cross-check on Google or with a physician whether this molecule which we are taking as part of our anxiolytic or therapy can interact with the immunosuppressant, whatever has been prescribed to us. So it's always good to disclose that we are taking these medicines so that doctor can cross-check quickly whether drug, whatever he is going to prescribe, is going to interact with the drug you are already taking.
Right, doctor. Thank you. So Sudha would come and she will be asking a couple of questions now.
Yeah. Thanks, Neetu. Yeah, I'll take it forward. So we have our next question from Neha Patel. So is it safe to go for knee replacement surgery in scleroderma, doctor?
Yes, pretty safe. Only thing what I will suggest to everyone, if you are contemplating any knee joint replacement, please do it quickly. The reason why I'm saying this is because as you delay that knee joint replacement, obviously your knee joint is not working optimally. So you are going to lose your muscle mass, both in the thighs as well as in the legs. And these are the only thing which you require after the knee joint replacement, because these are the muscles which will make you walk again. So don't delay that. And even if there is some sort of a circumstance where you are unfortunately going to get delayed, please keep doing regular exercises so that your thigh muscles, what we call as quadriceps, they are very important for the knee joint. They remain in good health so that after transplant you can walk easily.
Okay. Thank you, doctor. I hope that answered Neha's question. And let's go for another question from Akanksha, Kadia, and also Clara Arun. So what can be done to help with swallowing of food apart from sipping water? For me, thickness has increased in the esophagus, due to which if I don't chew properly, food scratches the throat and it starts to hurt. Any medicine or something that can ease the passage of food? Is this issue long term?
Yeah, this is definitely a long-term issue, and like I mentioned earlier, excuse me, somebody developing glossitis can have problem with chewing. The dry mouth can also, because less of saliva means you have to chew more, so that food is well lubricated and it can be swallowed easily. The other thing is, which is part of systemic sclerosis illness, is there is some imbalance in the throat muscles. It's not that we eat and food will automatically go into the throat and then subsequently into esophagus and then into the stomach. It is propelled by a group of muscles in the throat as well as in the esophagus. So there may be some incoordination because we all have we know that systemic sclerosis is a disease where there are fibrotic patches. Right. So similar patches can happen in esophagus also, and the part which is fibrosed is not going to function optimally. So the movement of the muscle will not be there. So food may stick at that point. But we can maintain a healthy mucosa by taking care of nutritional deficiencies, vitamin, mineral, or iron supplementation, and we take care of our food habit, where we have to take a small amount of food, chew it well, and yes, you do need lots of sips to swallow the food, because we can't do much about that part of the esophagus which is already fibrosed. We do hope that with continued medication, then there is a chance that it may improve later on. But as of today, I don't see much of a specific drug. If patients who have got secondary Sjogren syndrome, that is a severe dry mouth, then these patients can be tried out certain molecules which are available, like pilocarpine, which actually increases the salivary gland secretions, so can produce a lot of saliva and helps in lubrication. But then again, this has to be decided by the uh, treating doctor, whether you need pilocarpine or not. But yes, till then, as far as my long distance advice is, small amount of food, chew well, and if you feel that you can gulp it down with a small sips of water, then please do so.
Got it, sir. Thank you.
Okay, thanks, Doctor. So let's move on to another question from again Akanksha Kadia. My fingers have been largely affected with Raynaud's, so much so that the normal oximeter doesn't measure my saturation level. In fact, the fingerprint scanner hardly works. Had difficulty even while giving biometrics for passport. Is there a special device available that can be kept at home to check oxygen levels, especially with all the COVID scenes?
Yeah, okay. I find this is the most difficult question for me to answer actually. We don't have many equipments which are already available in the market to check for oxygen saturation. So what I suggest is that you can use your pulse oximeter on the earlobes. Here, you can just put the probe on the earlobe, because what we need is an area where you have sort of a blood circulation. Unimpeded blood circulation is there. So you can, if you can get the signal from there, then probably this can give you an answer. This is the best advice I can tell you, practical advice. There are actually a lot of equipments in manufacturing process which requires even authorization from authorities for approval. And one such, you can keep looking for this sort of equipment, which is called as Oxywear. Oxiwear. So this is a special device which is actually to be put on the ear pinna for monitoring the oxygen saturation level. But right now this is not available in India or anywhere, but it may be available soon.
Okay.
So I do agree with COVID, and we still don't know how long it is going to last. And so one needs to be prepared. But you can just try it out on your ear pinna and see whether it is recording signals or not.
Okay, thanks for that information, Doctor. So we have our another question from Rachita. There is lot of...
Sorry, Dr. Avinash has joined, I guess.
Okay.
Yes, hi, hello everyone. Sorry for joining a bit late. I'm still in my car though, so I thought I'll join from here. Hello, Vikas sir.
Very good evening, Avinash.
Good evening, sir. Yeah.
Okay. Okay,
So
let's
just
then
building
take
on that last question. So the other thing that I suggest my patients is a 2-minute or a 6-minute walk test, an indirect way to figure out how much tachycardia you are getting, is the distance decreasing, is something which can help you. Whether COVID has really affected the respiratory symptoms are affecting the COVID is affecting your lungs. That's another simple tool
Yeah.
that
So
you can utilize.
or you can just make out whether you are getting breathless
Yes.
much more easy as compared to previously.
Yes. Yeah.
Okay, then let's take a quick, a small introduction about Avinash, sir. So it's our pleasure to have you here, sir. So Dr. Avinash Jain initially has worked as a senior registrar at VS Hospital, Ahmedabad, and then got his DM degree in clinical immunology and rheumatology at SGPGI, Lucknow. After DM, he completed a fellowship at the University of Birmingham, United Kingdom, and then he worked as a senior research associate at SGPGI, Lucknow. So currently, he is an assistant professor in rheumatology at SMS Medical College, Hospital, Jaipur. Prior to this, he was an assistant professor and in charge at Department of Clinical Immunology and Rheumatology at Mahatma Gandhi Hospital, Jaipur. So the department actually deals with autoimmune diseases including arthritis, spondyloarthritis, psoriatic arthritis, degenerative joint disease, vasculitis, lupus, sarcoidosis, fibromyalgia, connective tissue disease, soft tissue rheumatism in pediatrics as well as adult population. And the department also deals with autoinflammatory diseases and primary immunodeficiency disorders. He was also a member of editing committee of Indian Rheumatology Association e-newsletter executive committee member, that is IRA, for the year 2020-21. He has many awards to his credit, including IRA Young Research Bursary Award, Best Oral Paper Award in IRA Con 2018, ICMR Travel Grant BSR 2018, Andrew Duff Class Award for the Best Original Article, National DM Quiz winner, and also the award for most cited paper in IGRD in the year 2020. Again, it's our great pleasure to have you here, sir. We warmly welcome you.
Thank you for the kind introduction. And I wanted to cut it short. Actually, Vikas sir is my teacher, and this is actually another opportunity for me to learn, these queries, how these are to be addressed. And हमने जितना systemic sclerosis सर से सीखा है, मैंने और किसी से नहीं सीखा. और मेरा जो BSR वाला अवार्ड था, पेपर वाला अवार्ड था, वो सर के साथ की गई रिसर्च में ही मुझे मिला है. I think Hindi, English दोनों comfortable. Hindi ज़्यादा comfortable रहेंगे सब. Yeah.
Absolutely,
No,
sir.
we are continuing in English, but we can use mixed language. And
Yes, mixed language. Haan, sir.
Avinash, you are a friend, man.
Sir.
And you are being so humble to give credit
Nice.
to me for your hard work.
We'll take it forward. So, Dr. Avinash, this question is for you. So this is from a patient who actually has a young son, a 13, 14-year-old boy. So she says that there is a lot of itching in the pigmented region, specifically in the neck, thighs, armpits, and above the elbows. They have applied many creams and taken medicines from dermatologists, but nothing has worked. There is also a lot of sweating, and it has become difficult for him to attend school. He's a school-going boy. So what is your advice to him?
I think this is a challenge. ये एक challenge है जो हम day and night face करते हैं, especially कुछ time के बाद वो area अगर बहुत so there both things are bad. अगर बहुत ज़्यादा dry रहेगा तो भी itch करेगा, and if there is lot of sweat on the skin, so that is also not good. So optimization of treatment is important. Moisturizer भी adequate amount में लगाना ताकि skin बहुत dry ना रहे. In fact, नारियल तेल is something which is very simple and सबसे सस्ता, way to take care of this itching. And then there are medications, I'm sure they must have tried or they might not have tried, like antihistaminics. Sometimes we give hydroxyzine, sometimes we give ranitidine as well. लेकिन हर चीज में ये ध्यान रखना है कि किसी भी चीज की एक्सेस माइट नॉट बी हेल्पफुल, क्योंकि बहुत ज्यादा हम एंटी एलर्जिक ड्रग्स भी यूज कर रहे हैं. जैसे फॉर एग्जांपल कभी कभार क्या होता है, ध्यान नहीं जाता है, वी आर यूजिंग ड्रग्स जो बहुत ज्यादा ड्राइनेस कर रही है स्किन की. तो एक यू हैव टू कीप अ चेक इन दैट डायरी कि वो क्या ले रहे हैं, कोई दवा एक्सेस में तो नहीं जा रहा है. एंड अ प्रॉपर cleaning of that area, application of moisture is something which is going to help. And gradually जैसे जैसे disease control होगा, skin soften होएगी, तो वो improvement आएगा. कुछ चीजों में हमें वक्त देना ही पड़ता है. मतलब despite trying our best and feeling bad कि कैसे इसको एकदम से ठीक कर दें, sometimes that's not possible. It takes time.
Sir, weather conditions also is a part of this?
Oh yes, it can be. So extremes of temperatures are not good. If the family has an option जहाँ पे temperature बहुत ज्यादा गर्म हो या बहुत ज्यादा ठंडा हो, both are bad. गर्म especially क्योंकि फिर आप बार बार skin dry होती रहेगी, तो you have to make more efforts to keep it moist. So that is another very important point that you brought out कि इस चीज का भी ध्यान रखना है. Including आजकल बहुत बार ये भी होता है, कभी गर्म कभी AC, कभी गर्म कभी AC. So that is another thing. I know it's not a practical answer कि कैसे उसको avoid करें, but बहुत ज्यादा extremes, बहुत ज्यादा अगर गर्म हो तो that is something which you can try taking care of.
Okay. Thank you, Dr. Avinash. Okay, again, Dr. Avinash, this question is for you. Does fundoplication surgery, is it useful for acid reflux? And if yes, then what are the risks?
So, thanks to this question, I got मुझे chance मिल गया थोड़ा literature भी review करने का. एक general fact और consensus ये है कि generally fundoplication के results उतने अच्छे नहीं आते हैं systemic sclerosis में. और प्रॉब्लम ये भी है कि बहुत ज्यादा डेटा नहीं है. जिन लोगों ने ट्राई किया है रिजल्ट्स अच्छे नहीं हैं, बट देयर आर सम सेंटर्स जहाँ पे बहुत हाई वॉल्यूम सर्जरीज होती है. वहाँ इससे कई मेथड्स हैं फंडोप्लाइकेशन के. एक रू एंड वाई मेथड से होता है. आजकल एक कोई एंटीरियर फोल्ड मेथड आया है जिसका भी लेटेस्ट पेपर आया है 1 या 2 साल पहले, बट उसमें भी सिर्फ 13 या 14 पेशेंट्स है इफ आई कैन रिमेम्बर करेक्टली जिसके रिजल्ट्स अच्छे थे. तो टू कट इट शॉर्ट, फर्स्ट एंड फॉरमोस्ट, आई एम श्योर अभी तक शायद पहले डिस्कस हो गया होगा, अगर आपने अपनी बाकी सारी चीजें ऑप्टिमाइज कर ली है, वेट रिडक्शन है, मोटे नहीं है, खाना टाइम पे खा रहे हैं, शॉर्ट मील्स ले रहे हैं, खाते तुरंत सो नहीं रहे हैं, कैफीन ज्यादा नहीं ले रहे हैं, एल्कोहल नहीं लेते हैं, स्मोकिंग नहीं लेते हैं, ये सारी चीजें आपने ऑप्टिमाइज कर ली है, कोई ड्रग जो ये प्रॉब्लम बढ़ा रहा है उसको बंद कर दी है, तो बहुत ज्यादा रिफ्रैक्टरी केसेस में जहाँ पे आपने पीपीआई भी 2 बार विद प्रोकाइनेटिक या रैनिटिडीन ट्राई कर लिया है, यू मे थिंक, बट इट इज वेरी अर्ली टू सजेस्ट कि ये एक रूटीन प्रोसीजर के हिसाब से जिनको भी बहुत ज्यादा प्रॉब्लम है दे शुड गो अहेड विद इट. The newer techniques are coming up. Maybe in another 5 years we might have a much better results than what we are getting now.
Okay, sounds interesting. Okay, so Dr. Aggarwal, this question is for you. My mother has rheumatic arthritis. My in-laws think I got scleroderma from her. Is it proven that it is hereditary? Will my kids have it too?
Yeah, interesting. Patients who have got autoimmunity in the families, they can have all kind of autoimmune diseases. So, and we do know that we have seen many patients or families where patient is having scleroderma and other members in the family are having either rheumatoid arthritis or systemic lupus or even myositis. So there is some kind of an autoimmunity gene which we know can run in families and can predispose you to systemic sclerosis. But if you really ask me how many times I had seen one member of the family having systemic sclerosis and also another member from the same family having systemic sclerosis, I don't recall more than one. Only one family I have where 2 members in the family are actually having systemic sclerosis. So it's generally not a very genetic disease, though there are many genes which have been associated with systemic sclerosis, which makes you susceptible towards it. But generally, this is not the case that it runs in families and the children might develop systemic sclerosis from an affected parent. So be assured, your children are not going to develop systemic sclerosis. But yes, one can be sort of watchful and can keep on actually getting them evaluated for autoantibodies if you are sort of that much jittery about development of some kind of autoimmunity later on. So just be in touch with the doctor and take your children along with you whenever you are meeting the doctor, so that they can have a very sort of a quick look. And if there is any suggestion of any autoimmunity, then they can prescribe adequate test or can examine the children for development of any other autoimmune disease.
Okay. Dr. Avinash, any thoughts on this from you?
नहीं, I completely agree. चिंता करने के से तो की बात ही नहीं है, बिकॉज सर ने तो एक फैमिली देखी, मैंने तो एक भी नहीं देखी कि जिसमें 2 लोगों को सिस्टेमिक स्क्लेरोसिस साथ में हो. अगर ऑडियंस में से कोई लोग हैं जिनमें ऐसा है तो दे कैन टेल अस, बट इट इज दैट अनकॉमन कि वो फैमिली में रन करे. मैं तो बल्कि ये कहता हूँ उससे ज्यादा चांसेस हैं कि अगर आपको हाइपोथायरॉयडिज्म है, डायबिटीज है, हाइपरटेंशन है, जो सबसे ज्यादा कॉमन है, अगर चिंता करनी तो उसकी करो, उसके हिसाब से अपना डाइट, अपनी लाइफस्टाइल अच्छी करो. सिस्टेमिक स्क्लेरोसिस, मैं तो एग्जांपल और देता हूँ, 100 बच्चे करो आप, एक को होगा, 99 को नहीं होगा. तो इफ दैट हेल्प्स देम, गिव्स देम अ स्माइल, so this is how what I tell them ki don't worry.
Okay. Dr. Avinash, this next question is for you. We generally, all of us complain of a lot of fatigue. Mostly we say that, we are fatigued. So can we hope that, we will have better days without fatigue? Is there something that we can do that, so that we are not fatigued all the time?
Right. So fatigue सिस्टेमिक स्क्लेरोसिस में बहुत सारे कारणों से हो सकता है. एक सिंपल सा फैक्ट दैट जब हमें पहले ही पता चल रहा है कि इतनी लंबी बीमारी है और दवाइयाँ इतनी लिखनी पड़ती है, इनफैक्ट कई बार मैं लिखते लिखते मुझे फटीग हो जाता है, 7 दवाइयाँ लिखी, एक इसकी, एक रिफ्लक्स की, एक स्किन ये करने की, तो इट स्टार्ट्स प्लेइंग एट मेंटल लेवल ऑल्सो. सो यू हैव टू बी अ लिटिल पॉजिटिव, यू हैव टू टेक केयर ऑफ योर न्यूट्रिशन, डिजीज कंट्रोल अच्छा रहना चाहिए, एरोबिक्स एंड योगा, जो ब्रीदिंग एक्सरसाइजेस विकास सर हर बार अपने पेशेंट्स को बोलेंगे, सिंपैथेटिक एंड पैरासिम्पैथेटिक सिस्टम को बैलेंस बनाना जरूरी है. तो देयर आर लॉट्स ऑफ कंट्रीब्यूटरी फैक्टर्स. ये सब हैविंग सेड ऑल दैट, ये सब बताने के बाद भी देयर विल बी डेज जब उतार चढ़ाव आएंगे. जैसे बीपी शुगर में उतार चढ़ाव आते हैं, 365 के 365 दिन आपका फास्टिंग शुगर बहुत अच्छा रहेगा, ऐसा नहीं हो सकता. हम नॉर्मल इंडिविजुअल्स को भी दिन ऐसे होते हैं जब हमें फटीग आता है, बट अगर हम टाइमली ट्रीटमेंट लें, एक्सरसाइज करें, डिलीजेंटली फॉलो करें, और इट्स लाइक योर ये आपकी अगर शादी नहीं हुई है तो पहली शादी है, एक नई बीवी या हस्बैंड है आपका, आपके साथ रहेगा और इसके साथ खुश रहना है. दैट इज व्हाट यू हैव टू ट्राई. डाइवोर्स इतना इजीली होता नहीं ना इंडिया में. तो
Avinash, you have only one chance.
yeah, only one chance.
Yeah.
Thank you for that lovely answer. Okay, Dr. Aggarwal, next question. Can a dermatologist help in any way in our condition? Should we not contact a dermatologist?
Yes, I think in a lot of ways actually, dermatologists can be helpful because they do evaluate skin much more diligently than all of us, because we look at patient as a systemic disease patient, whereas they look very closely towards the skin, and the skin is one of the very important organs which is affected in systemic sclerosis. That is one thing. Other thing, many times we don't have answers for various skin issues, like somebody developing localized scleroderma on top of systemic sclerosis, where you develop some kind of patches or plaques which are fibrotic, some pigmentation issues, depigmentation, hypopigmentation, or dark pigmentation of the skin. Even like you had asked about the pruritus, that itching problem in the skin, they can always help. I just wanted to add to the itching, because itching is also one of very common problem in systemic sclerosis for which we don't have many things to do. But there are studies where people have shown that a lot of opioid receptors are overexpressed in this skin. And this is my personal viewpoint. I may not be able to substantiate it by some research, but my advice is strong enough, because one of my very close scientist friend in one of a very reputed research lab in Lucknow is actually working on this area, and he is trying to develop some opioid receptor antagonist which can help itching. So I asked him, one day we were sitting like that. So he said, yeah, we are in final phases of extracting a particular chemical, a long chemical name he brought out, which I don't remember. And this will help a lot of your patients with systemic sclerosis. I said, whenever you will be bringing it out, it will be a very costly cream or drug when you will market it. He said, of course, it will be costly. Then I said, please tell us, our patients are poor, if we can have some kind of an advice from you where I can help them out. And meanwhile, drug is going to take many years to come to the market. So he told me, I'm just narrating it what he told me. And this I find to be very effective in my OPDs for last 2 to 3 years. The kadi patta, if all of you can understand that, kadi patta or meethi neem, take some 20-25 leaves of that, wash them, dry them, clean them. Now then put some mustard oil on that, so that leaves are completely drowned in that mustard oil. Now just make a paste of these leaves when they are under the cover of mustard oil. And this paste you can apply at the site of itching. That one particular problem that you have asked earlier, that mother is asking about the boy having a lot of itching in the school. He can try that out and see if this paste is going to relieve the patient or not. For hyperpigmentation and depigmentation, dermatologists can help with drugs like or therapies like UVA therapy, that is Soralane, and ultraviolet A or ultraviolet B therapies, because there are case reports where people have reported that patients, by going into the sun, their depigmented patches have become normalized. So that means that sun's ultraviolet rays have got some effect in having an effect on the depigmented skin in systemic sclerosis. So always be in touch with a dermatologist, because they can help you out in some of your skin problems. And since most of the patients are females and they are very much concerned about their looks, and obviously this is a problem for everyone who is affected with systemic sclerosis. So if you can have some help from a dermatologist, please go for it.
Right.
Thank you for that. Dr. Avinash, next question is for you. My BP remains low, 100 by 60 types or even less on the machine, but I don't feel dizzy or any low BP symptoms. Is my BP actually low, or is it because my skin is hard, the BP machine is not measuring it properly?
So they tend to remain, if we अगर हम जो measure करते हैं, because of multiple reasons, including the stiffness, even the stiffness of the vessels, क्योंकि वहाँ पे भी proliferation हो रहा है, तो उस वजह से जो blood pressure measure करते हैं, ज़्यादातर लोगों के 100 या 90 systolic पे आते हैं, and they come walking. So what is important is आप उस number से परेशान ना हो. Important क्या है कि अगर आपका जो जनरल बीपी 100 है और उससे गिर के वो 80 आ रहा है, दैट इज समथिंग व्हिच यू हैव टू नोट, और उसके साथ सिम्टम्स आ रहे हैं. नहीं तो 100 की रीडिंग को यू डोंट हैव टू रियली वरी एंड उसकी चिंता करने की जरूरत नहीं है. तो दैट इज बिकॉज ऑफ द प्रैक्टिकल इश्यूज. यस.
Thank you for that. Okay, next question to you, Dr. Aggarwal. What causes dry throat and mouth?
Yeah. So this is most likely in a chronic illness because of chronic or secondary Sjogren syndrome, which I earlier mentioned. So it is a natural course of most of the autoimmune diseases, including systemic sclerosis, that they tend to develop dry mouth and dry eyes also. Then you just need to take some lozenges, or you can take sorbitol containing chewing gums, which actually stimulates your salivary secretions. And in one of the earlier questions, as I mentioned, that some of these drugs like pilocarpine can help. Otherwise, any deficiency of minerals or iron or vitamins, if it is there, then it can be corrected and can help in relieving some of these symptoms. But many times it may be very difficult actually to treat a dry mouth or dry eye. For dry eye, you have a lot of lubricant, eye gels and eye drops, which can be prescribed and should be taken regularly. Please don't get frustrated by putting eye drops 3 or 4 times or 5 times in a day, because at the end of the day, you will be preserving your cornea for a long period of time. Otherwise, your eyes will suffer a lot after the age of 50, 55, when you need them the most, actually. So take care of each and every. See, there are a lot of drugs in pipeline, which we are hopeful of making it to the market with substantial benefit in fibrosis of systemic sclerosis. Because I happen to be in touch with people who are the sort of leaders in the world in research in systemic sclerosis, and we do share thoughts online and sometimes in meetings. So I know that a lot of drugs are being tried out with various mechanisms of actions, and I'm very hopeful that some of these mechanisms are definitely going to be sort of uh, proven to be beneficial for treatment of patients. So everyone of you who are hearing this conversation should keep sort of faith and should be hopeful that future is going to be very bright.
And I think sir, साथ ही साथ जो दवाइयाँ ड्राइनेस करती हैं उसका भी आपको ध्यान रखना चाहिए.
Yeah.
Especially हाँ, कई बार हम बहुत over the counter drugs use कर लेते हैं. That is a problem.
Yeah.
Dental hygiene is equally important. Brush your teeth twice. 2 बार brush करें. And exercise again, जैसे सर ने बताया, there are sugar-free chewing gums containing sorbitol that helps. कुछ sprays भी आते हैं आजकल that can also help. So yeah, and maybe a thought of really nice, tasty food, garam garam.
Golgappa.
Golgappa. That will be a good exercise for mouth opening also.
Yes, secretions, increasing the secretions actually.
Yeah, मेरे बढ़ा दिया सर आपने गोलगप्पा बोल के.
Okay, doctor, the next question I think I will put it to both of you all, because this is something, जैसे अभी कुछ भी होता है, छोटी चीज मान लीजिए बुखार चढ़ गया, आपका रूमेटोलॉजिस्ट बोलेगा जाइए आप जीपी के पास जाइए दिखा लीजिए, and 95% times we see that GP does not understand autoimmune disorder or scleroderma, right? आप उन्हें बोलेंगे सर मुझे scleroderma है, so he looks at you with a very very blank expression, because there are a lot of medicines which cannot be taken with the medications that we are taking, right? Or generally even in cities like Mumbai, we see they have that pudiyas made with that yellow red pills, right? We don't even know what they are. So how do we deal with the situation? Because for every small thing, running to a rheumatologist is not the answer, and they don't have that bandwidth. Sir, I'm having a cold today. Sir, my throat is itching today. I have to go to a GP, but my GP is blank about what is scleroderma. So
yeah, I'll take that answer for the first. See, absolutely right. In fact, during my MBBS days, I just happened to read about the disease and didn't know anything about it, except to just rattle it back to my professor in the quick answer session round in the exam. During my MD, we got a question on sign scleroderma, which we miserably failed because we couldn't make out. Our English was very poor. What does it mean? What is sign scleroderma? We were not aware of it. We just put scleroderma, that's it. Even after doing my DM from clinical immunology at SGPGI, this is one disease which I never wanted to see because there was not many hopeful conditions. No drugs were available. Every winter, patients were coming with gangrene and their fingers getting auto-amputated. And these are young females who are crying all the time. And we were actually asking to get cervical sympathectomy, where we put in an injection here in the neck. And many times, a lot of complications has arisen because of that injection, because it will penetrate sometimes into the lungs and will cause pneumothorax and other problems. But when we say like this, then that doesn't mean this disease should not be treated or should be tackled by the doctors. When I got interested in 2007, we realized that this is one disease which I am learning from now onwards. And from there, we got that story of tadalafil, and we were lucky, and that boosted my morale and motivated me to understand this disease much better. Even today, we are always learning about this disease. But GPs, the MDs, they don't know about this disease in great detail because it is not being taught in our medical curriculum, both at undergraduate as well as postgraduate level. We did a survey in 2000 and I think 19 in one of the APCons, that is the biggest meeting of Associations of Physicians of India conference in I think it was in Bangalore, where we got some responses from 1,000 or more physicians. How do they feel about rheumatic diseases? I'm talking about in general rheumatic diseases. And 70 to 80% said that they don't feel very confident in dealing with patients who are having rheumatic diseases. We didn't specifically ask about scleroderma, but I'm 100% sure that more than 99% of them would have said that they are sort of not very keen to see a patient of systemic sclerosis. So this is a problem in our medical curriculum. It needs to be tackled at the administrative level. One need to treat rheumatic diseases at undergraduate level as well as at the level of postgraduate. For this, we are making an effort right now. Me and my colleague, Dr. Durga Prasanna Mishra in my department, we are actually designing a curriculum for undergraduates as well as postgraduate medical students. We plan to bring it online as well as we physically want to deliver sessions in state medical colleges so that more and more awareness is actually generated. We want to introduce a mechanism whereby people who are in medical colleges, they can come for a short-term training at our place or at other places, go back and start rheumatology OPDs in their respective medical institutions. So that, because in India, what we realized during this survey, every rheumatologist, there are around 1,200 rheumatologists registered with Indian Rheumatology Association as of today. And there are patients who are in crores. So we realized that for these 1,200 rheumatologists, every rheumatologist has more than 232,000 patients. So if a rheumatologist sees 20 patients a day, 6 days a week, without taking any break whatsoever in his life, the person I'm seeing today will be coming to me for follow-up after 42 years. So this is the sorry state of affairs in this country. Thankfully, there are a few more centers where DM rheumatology training has been started very recently, last 2-3 years, but still it is very, very inadequate. So we plan to bring in a proposal to the government. But before that, we want to prepare ourselves with the curriculum so that more and more GPs can be made aware of. But I agree with you, a lot of problems in sending patients of autoimmune diseases to any GP. And scleroderma, nobody will like to see. I am very sure about it.
Absolutely, sir. They don't understand the head and tail of it. This is one part that, we have all seen it, right?
Yeah.
Not only seen it, but, we have seen that, we suffer a lot for that reason because, at times we have been given wrong medication.
It may happen.
Dr. Avinash, would you like
I
to add
agree
something?
with, yeah, no, that is the long way. Ultimately, करना तो यही पड़ेगा कि if we have to reach more people, the only way is by teaching more people because there is a limit to which the number of patients you can attend to and give them some quality care. So we are doing our bit, like sir has been, I think, doing it at a very, very big level. So हम लोग gradually we are going to organize teaching programs. We are trying. You will be surprised कि even यहाँ पे अभी rotation भी नहीं होता है medicine वालों का. So we have talking to the administration here, the medicine people, pediatric people, they should rotate with us so that they understand what is happening. I think बीच-बीच में कट रहा है क्या शायद? So that is, yeah. So this is what is needed. धीरे-धीरे सबको पढ़ाएंगे, MBBS level पे लाएंगे, तभी जाके कुछ होगा. But for the timing, what we can do is कि there are some medications which may interact with your drugs, जिसका आप अपने डॉक्टर से पूछ सकते हैं कि is there something which you need to avoid. But in general, जो regular fevers, upper respiratory tract infection है, cold है, diarrhea है, that is something which we can tell our patients कि ये आप आराम से किसी भी डॉक्टर से आप दवा ले सकते हैं. उनमें जनरली जो वो ड्रग्स यूज करेंगे वो बहुत इंटरैक्ट नहीं करेगी. बट फिर भी अगर डाउट है तो आप सिंपली ये कह सकते हैं डॉक्टर से कि भाई हमें ये दवा चल रही है. आजकल सबके पास कैलकुलेटर्स, मेडस्केप अप टू डेट होता है, ड्रग इंटरेक्शंस इजीली वो उसमें चेक कर सकते हैं. एंड आई एम श्योर कि वो शॉर्ट ड्यूरेशन की दवा आपकी इलनेस को ड्रास्टिकली नहीं अफेक्ट करेगी. बट स्टिल इफ यू हैव अ डाउट, तो यू हैव टू कम बैक टू योर rheumatologist if you can, if time permits.
Thank you for the insight. Dr. Jain and Dr. Aggarwal, I just wanted to ask you all, it's nearly 6:30 and we have some more questions left. Are you all okay extending? Or,
Yeah, please go ahead.
Yeah. मेरा भी पेट्रोल है इसमें, इसी चल रहा है गाड़ी में, कोई दिक्कत नहीं है.
Thank you. Okay, so the next question is for you, Dr. Aggarwal. Is taking MMF for a long period dangerous?
Not at all. See, there are enough studies which are available from renal transplant recipients since 1990s, where MMF is a safe molecule, provided you are monitoring your investigations and you are regularly in touch with your physician. So don't need to worry.
Okay, thank you. Okay, Dr. Avinash, can LDN be taken for body pain?
Which one, sorry?
Can LDN be taken for body pain?
LDN?
Low dose naltrexone.
Naltrexone. Okay. Oh, that's a good short form. तो अब इंडिया में तो बाहर it is being used. I have not used. Even for fibromyalgia, and like sir was pointing out, there is I think some data about naltrexone for fatigue का तो है, even for itching there is some data. So I think it's a good option, but the problem is the dose at which it is available in India and the dose which is needed for these kind of symptoms, it's a little difficult. You probably have to cut it and make a paste and then use 1/4 portion of it. I can check the exact dose and share with you all, but yes, it is an option provided it is easily available and you have tried all other options. It's being used outside.
Okay. Thank you a lot, Dr. Avinash. Dr. Aggarwal, repeated cough troubles a lot, so provide solution to minimize the same.
Yeah, I think this is part of your interstitial lung disease. If that is so, get it evaluated and get the medication. Otherwise, long-term cough is not the sort of symptom of systemic sclerosis. If it is happening, it is because of lung fibrosis or interstitial lung disease. So unless you treat the condition, you will not get relief.
Okay, thank you. Dr. Avinash, lungs are working just at 28% capacity. Fibrosis is increasing at an alarming rate. So suggest a solution to manage the deterioration so that to increase the life expectancy.
Right. So सबसे पहले तो 28% का नंबर देख के घबराना नहीं चाहिए, क्योंकि होता क्या है बहुत बार जब ये पल्मोनरी फंक्शन टेस्ट कर रहे होते हैं तो दे फाइंड इट वेरी डिफिकल्ट टू डू. उसमें जो फोर्स एक्सपिरेटरी टाइम करके एक चीज होती है वो कई बार आपसे रिपीट करवाएंगे, फिर ढंग से नहीं हो पाता है तो आपकी वैल्यू एरोनियसली लो आ जाती है 28. तो व्हाट इज इम्पोर्टेंट इज आपके सिम्टम्स क्या हैं एंड देन यू हैव टू सी वेदर इट वाज डन प्रॉपर्ली और नॉट. एंड लाइक सर पॉइंटेड आउट, cough can be an starting point when you will realize कि fibrosis has just set in. तो वो परसेंटेज को देख के 6 मिनट वॉक को टेस्ट को देख के सिटी स्कैन में कितना एक्सटेंसिव इन्वॉल्वमेंट है उस हिसाब से there are lot of drugs which are now being used. बहुत डेटा आ रहा है इंक्लूडिंग एंटीफाइब्रोटिक्स का भी और डेटा आ रहा है. सो द प्रेजेंट एज वेल एज फ्यूचर लुक्स गुड, बट टाइमली आना जरूरी है. सिर्फ नंबर्स को देख के मत घबराओ कि 28% का मतलब ये नहीं है कि आपके 70% लंग उड़ गए हैं. You have to see in total what is happening.
Actually, yes, it actually makes a lot of sense. Thank you. Dr. Aggarwal, the next question is for you. I am suffering from MCTD and my muscles are very weak. even doing even brushing my teeth is a task. So is IVIG going to help me?
Yeah. So, see, he's asking about a specific drug. Uh, I will not be able to answer in a given scenario without evaluating a particular person. But whosoever has suggested must have thought about it, and somebody knowing about IVIG as treatment of symptoms is very well educated enough to guide you correctly. That is for my first response. And IVIG has been shown to be sort of beneficial in patients who have these symptoms. So please trust your doctor, and if you can afford it, because it's a very costly treatment, please go ahead.
Okay, thank you.
Sir, to add on to it, because I don't know, that's a very important thing sir said कि अगर किसी ने बताया तो सोच समझ के बताया होगा, लेकिन अगर यहाँ पेशेंट ने जैसे स्टार्ट में ये बोला कि मेरी मसल्स वीक हो गई हैं, तो यू हैव टू फाइंड आउट कि वो एक्चुअली मायोसाइटिस है कि वो वीकनेस, लैक ऑफ एक्सरसाइज, प्रॉपर न्यूट्रिशन की वजह से है. डोंट कंसिडर आईवीआईजी एज इम्यूनिटी बूस्टर, और डोंट कंसिडर एज समथिंग कि वो आपका मसल बढ़ा देगा. पॉकेट जरूर हल्की कर देगा बिकॉज इट्स वेरी एक्सपेंसिव. सो यस, इट इज अ गुड ड्रग प्रोवाइडेड इट इज यूज्ड व्हेन इंडिकेटेड. इट्स नॉट अ ब्लैंकेट स्टेटमेंट कि आईवीआईजी दे दो तो सब अच्छा हो जाएगा.
Okay. Okay, doctor, acidity tablets, everybody has a different view कि 1 घंटा पहला लेना चाहिए, just before breakfast लेना चाहिए. So actually, what is the time frame that you need to take the acidity tablet?
So for
yeah, please go ahead.
नहीं सर प्लीज सर आप बताइए सर, कुछ नया मिल जाएगा. अच्छा है.
No, acidity tablets means like if you are asking for proton pump inhibitors, then at least 45 minutes to 1 hour before meal.
Yes,
it should be taken, because it is absorbed in adequate amount at that time only. If you take it with meals, absorption will be less and there will be less efficacy. If you are talking about some antacids, syrups, then they can be taken 15 to 30 minutes before the meals.
Right.
That is all.
Totally agree.
Okay, thank you. What is the solution to long-term upset stomach, nausea, and headache, Dr. Avinash?
Right. So 3 symptoms: nausea, vomiting, headache. They can be related, they can be unrelated. If it is headache which is bringing nausea and vomiting, check your blood pressures. Migraine तो नहीं है, ये देखो. Or is it because of some vasodilators you are taking, जैसे calcium channel blocker कभी कभार शुरू करते हैं तो उससे heartburn, palpitations, headache, tadalafil से भी ऐसा हो सकता है. तो that is something you have to see. अगर nausea और vomiting को अलग से देखें, headache अलग से देखें, तो depending किस कारण से हो रहा है, और systemic sclerosis में हमें मालूम है most of the time वो reflux वाले issues रहते हैं. तो like has been discussed previously, treatment optimization, lifestyle modification, खाने के बाद तुरंत सोए ना, 3-4 घंटे जागे रहें, वॉक, कोई ऐसी ड्रग है जो ज्यादा रिफ्लक्स कर रही है वो अवॉइड करें. आपकी कोई ऑस्टियोपोरोसिस की दवा चल रही है तो उसका रूट चेंज कर ले. आजकल आईवी मेडिकेशन, सबक्यूटेनियस चमड़ी में लगने वाली मेडिकेशंस भी आ गई. तो डिपेंडिंग ऑन व्हाट इज द कॉज, इट कैन बी टैकल्ड दवाइयों से और लाइफस्टाइल मॉडिफिकेशन से.
Okay, thank you, Dr. Aggarwal.
Yeah.
I am frequently observing swelling around my eyes in the morning and in the ankle area in the evening. So is there any test I can do to identify what is the issue?
Yeah. One just need to be careful about the renal involvement, because if you tend to lose protein from your kidneys, then you tend to develop these kind of symptoms. But this may not be a very appropriate answer actually, but just by hearing about the symptom. But if you really ask me to reply to that, then I must say that please be careful and get your urine examined, urine for protein and microscopic examination, and go back to your treating physician who can rather, I will suggest first you go to your physician, discuss this symptom with him or her, and go as per the advice.
Okay, thank you. Dr. Jain, I sometimes feel numbness on tongue after brisk walking or after climbing 2 or 3 floors. So what could be the reason? Is it related to my illness?
Numbness in the tongue.
Yes.
Right, बहुत ही specific symptom नहीं है, but sometimes I think if you are catching your breath and respirating, मतलब बहुत ज़्यादा अगर आप सांस तेजी से ले रहे हैं, पसीना ज़्यादा आ रहा है, तो you might be feeling, a strange sensation in the tongue or more of thirst, I would say, but not exactly a symptom of any particular thing. कोई चीज की तरफ इशारा कर रहा है ऐसा मुझे तो नहीं लग रहा है, unless वो लगातार रहे, numbness हमेशा बनी रहे, तो vitamin deficiency हो सकती है. But if it is only related to exertion, तो maybe a sip of water might help.
Okay. Okay, thank you. Dr. Vikas, I have developed little itching on skin near my chest, back area, shoulders from last 3-4 months. I am also very prone to runny nose, coughing, and common cold. What could be the reason and what should I do to treat it?
Yeah, this could be just part of generalized sort of allergic phenomena. And as we have already discussed so many things about itching in the skin. But if you combine the two together with running of nose, then obviously you have some kind of an allergic vasomotor symptoms that we call as. And here, if you can just go back to your physician and take his advice, if he prescribes you some kind of antihistaminics or other drugs, then please take the help and try them out and see how your symptoms actually improve with that.
Okay. Okay, Dr. Jain, there is one question. We have one of a patient who has actually a lot of calcinosis. So she's asking any solution for calcinosis cutis. For me, there are many in the buttocks.
Right. So calcinosis cutis अभी भी थोड़ा सा एक डिबेटेड टॉपिक है. कुछ लोग कहते हैं कि इन्फ्लेमेशन अभी भी बहुत एक्टिव है, उस वजह से हो रहा है. कुछ लोग उसको मोर ऑफ सीक्वली मानते हैं कि दैट हैज रिजल्टेड इन डिस्ट्रोफिक कैल्सिफिकेशन. सो देयर आर मल्टीपल वेज टू हैंडल इट. हम लोग जनरली थोड़ा इन्फ्लेमेटरी पाथवे पे भी फोकस करते हैं, एंड देयर आर ड्रग्स लाइक bisphosphonates which have also been used for calcinosis cutis. And lately, thoda bahut data and experts opinions के through we have realized कि tofacitinib is also helping. So there are a lot of drugs. आप अपने rheumatologist से discuss करें, वो ये भी check करेंगे कि बाकी जगह disease कितना active है, बाकी organ में कितनी activity आ रही है, क्या हर जगह disease active है या सिर्फ और सिर्फ calcinosis है जो परेशान कर रहा है. तो अगर जगह बहुत जगह डिजीज एक्टिविटी है तो ट्रीटमेंट ऑप्टिमाइज करेंगे तो दोनों में हेल्प करेगा. सिर्फ कैल्सिनोसिस क्यूटिस है तो मे बी अ ट्रायल ऑफ इम्यूनोसप्रेशन और बिसफॉस्फोनेट might help.
Okay. Gautami, I hope that answered your question. So we'll take the last live question from Rachita, and then Sudha will take it over. Rachita ji, you want to ask something?
Yes. Good evening, doctors and everyone. Dr. Vikas, as you told about UV treatment, our dermatologist also told this treatment, but it is impossible to take my child for 3 days in a week. But as you told about kadi patta and mustard oil paste, when we apply, doctor, before or after bath, and for how many days?
Yeah. See, this is only going to be a symptomatic treatment. So you keep on applying, and every time you apply it after the bath, because then it is going to be there for a long period of time, and it will give a relief for a longer period of time. So continue as long as you need it. There is no end to it. So I won't be able to tell you exactly for how many days or weeks you have to give, and then after that, this symptom of pruritus will be sort of taken care of. But if it is there, you can apply that. And this is a very cheap and home therapy, if you say like that, with a very scientific background to it. Can you hear me, Rachita ji?
Yes, doctor. I think Rachita, you could hear him, right?
Yes, yes.
Okay. Sudha, please take over.
Yeah, thank you, Rashmi. And yeah, thank you both the doctors, Dr. Vikas Aggarwal and Dr. Avinash Jain, for your valuable time, and also for such an interesting and very interactive session by answering all the queries, very informative. And we hope we will be having you, I mean, both of you again to help us and guide us to better combat with this disease. Definitely, after this session, our fellow warriors will have better insights to their issues, and they can make it very better. So, thank you. Thanks a lot, both of you doctors, and yeah, thank you all the attendees for joining, and have a great evening. See you all again in the next session. Thank
Thank
you.
you,
You all.
Dr. Avinash. Thank you,
Thank you.
Dr. Aggarwal.
Yeah.
Thank
Thanks
you.
for
Thank
the
you.
opportunity. Yeah.
Thank you,
Yes,
Dr.
yes.
Vikas and Dr. Avinash. So we hope to see you again soon, sir.
It's really
Great
good to see
pleasure.
you guys smiling, yeah, all the time.
It's only because of doctors like you we get the motivation to keep smiling, doctor.
Right. I wish wife also says the same.
Asking for
Thank-
impossible.
Yeah. Right.
Thank you, doctors.
Yeah. Thank you, ma'am.
Thank
Have
you.
a
Thank you, sir.
wonderful evening.